Counselor Smith and Counselor Hanson are both on the Zoom, and there are the public is invited by Zoom. I don't know if we have anyone on there yet, but.
We do, yeah.
We do? Great. All right, welcome to everyone. We'll be starting off. Matt is is our city planner, and you can introduce yourself, but he's going to be our moderator tonight and direct the whole workshop for us.
Yeah,
So go
hopefully.
ahead.
Yeah, so I'm Matt, city planner. So the kind of system for tonight will kind of be Tina, our general assistance director, will start off just by explaining her role at the city and the process for GA and how she works with her clients. And then what I'll do is, if I could actually kind of start, could one person from each organization raise their hand so I can kind of get an idea of how many organizations are here? 5, 6. Oh, wait. So that's about. It's good. It's not quite as many as I thought was going to be here. So after Tina does her introduction, we'll kind of ask one person from each organization to come up to the podium, give an introduction of your organization, the role, kind of answer the first 2 questions we had sent out. What your role within the greater context of homelessness in our community is, and then what are the key barriers your organization addresses. Then return back to your seat. Maybe take like a minute to a minute and a half to do that introduction. And then the next 2 questions will kind of be more of a group conversation, brainstorm, but we'll try and get people to come to the podium so that's audible through the live stream too. But it'll be a bit more free-flowing. You don't have to necessarily, you can make kind of like a cue at the podium if you've got thoughts to say. And then, if someone says something that you agree with, maybe don't expound on it too much more. We like to try and keep this to 90 minutes, so. We got a lot of people in the room who might want to speak. So let's get started, Tina.
Do you want me to do it here?
Sure.
Hi everyone, I am Katina Van Eylenstein. I am the GA Director for the City of Ellsworth. Many probably know me. I've worked with probably many of you. I'm going to make this short, but for people that do not know what General Assistance is, it's a program that is run by municipalities in the state of Maine that help assist with basic necessities such as rent, heat, electric, anything that is really a basic necessity that is needed. GA used to be kind of on the back burner, but it has since become the front line now because there's been a lot of programs that have been canceled or non-existent anymore, or just typically don't have funding. And so we're kind of become the main financial resource for most of necessities in the municipality. And I'm here tonight for anybody who has any questions. I also have my card for anybody who doesn't have my contact information, so I want to keep it brief, but thank you so much.
Do you want to go into a little bit about roughly like the trends you've seen in GA? The amount of calls you've had in previous years,
Sure,
or clients
absolutely.
you've had. You can talk to the council about that.
Oh, sorry.
Would you mind going to the podium? Because
Absolutely.
It's a little awkward. Thank
I'm
you.
usually loud, but.
I know, that's okay. But you're away from the microphone. Thank you.
So, yes, to kind of elaborate on the city's increased need of housing, and we've had a significant increase in homelessness, and what I've seen recently is most of our homelessness situation has kind of been coming from surrounding municipalities. I think that is a large increase because I believe most municipalities now are running into the same situation that we're in. It's a whole statewide problem. And I think the city of Ellsworth has been handling it well. I do appreciate a lot of help from the local agencies recently that has reached out to help the city find ways to manage the homeless situation. I do want to say thank you to Healthy Acadia. They've been a great help for me with my emergency homeless situations, because I do have to keep in mind that general assistance isn't just for homelessness. There's also many situations that are still out there that are the elderly who are still needing assistance with heating assistance, still needing assistance with healthcare or medications, personal household supplies such as that. So with that being said, having the additional help for the increased need from my surrounding agencies has been a godsend, to be honest with you. I appreciate it. Thank you so much. Any other thing you think I should elaborate on at the moment?
No, I think that's
Okay.
good for now.
I don't want to talk too much because I know everybody wants to hear.
Thank you, Tina.
All right, maybe if we could start in the front row here and then circle our way up and back around with organizations.
Hi, everyone. I'm Tracy Hare, I'm Executive Director of Home Inc., and we run the 4 homeless shelters in Hancock County. And I'm about to be stepping down from my role, so Rosa Moore will be your contact going forward. We have 53 beds of capacity in Hancock County. 25 of those beds are in Ellsworth. And 50% of our zip code data in Orland comes from Ellsworth as well. So the zip code piece, it's a statewide issue. I will add that the second highest zip code data is coming from Bangor. But Ellsworth by far is the number one, the highest zip code data that we have in all 4 of our homeless shelters. And I'll stop after this point. I hear you. I see the challenge that we're facing. I've been at this for about 20 years. In this last year, we have provided 15,000 bed nights across all 4 shelters serving our service area. That's an increase of 6,000 bed nights from last year, the year before, sorry. We're about to do the point-in-time count in a couple of weeks, and we'll see what that data looks like. 45% of the families presenting homeless right now have a kid in their household. And it's a mixed bag. Most people are coming, the number one cause of homelessness right now is affordable housing. We have many people who are employed who just aren't getting by. I don't know if you have any more questions, but I'll just focus on homeless services. We do a lot of other things, but for tonight, if you have questions, feel free to reach out.
Thank you.
Oh, I forgot to add,
That's the photo.
I'm also just finishing my term on the Statewide Homeless Council and Regional Homeless Councils. I was chair, and so I can give some insight into if you have any questions about where we fit in Ellsworth in relation to the bigger crisis in the state.
In the next row back, I think, or you, it's a different organization, sorry. Yeah, go ahead.
Hi, everyone. My name is Marcy Dean, and I'm the Residential Director for Nextstep DV Project. And what we have to do with homelessness is that idea that somebody in the middle of the night is unsafe and they need a safe place to go. We have a shelter. It's in it's in Washington County, but we cover Hancock and Washington counties. About 50% of our shelter requests last year did come from the Ellsworth area. And we do cover, we accept, just like Tracy was talking about, it's a statewide problem. We take calls from across the state. We're a 12-bed shelter, so we don't have a lot of capacity. And I can tell you that as soon as we have an empty space, we have somebody else calling us saying they need that space. In the last 2 weeks, I've had other DV projects calling, hey, do you have room? Do you have room? And they're like, you're our last person to call in the state, and everybody's full. So it is a huge problem in our area. The key barriers, somebody is fleeing domestic violence. We serve people fleeing domestic violence and their children. So we're not the lowest barrier of shelters because of that, but we still try to serve everybody that we can. And additional resources, affordable housing, affordable housing, affordable housing. We can have a person come into our shelter, we can work really hard and get them a voucher, but them getting out into housing It's just because the prices of housing aren't matching the fair market value rates, the voucher isn't being taken by a landlord. Those are the kind of things that we run up against all the time. And additional, that's the big thing. And, just listening to us, engaging with us, talking to us, I think that's awesome. Invite us to meetings and see what's going on with our agencies and communicate with us so you know what's going on. I think that this is something that you're doing right now that is really going to be helpful to our conversations. And we hear from general assistants. We've had people call, say, hey, this person, they're here, they don't have a place to go, and we try to resource too. Our 24-hour hotline is where we answer our calls, and that's where a lot of people, if they have a need, call. So we get a ton of calls about homelessness. Sometimes it's not DV related, but we'll say, hey, Healthy Acadia has the warming center. Home in Orland is a place that you could check out. So we do resource that way too. Can I take any questions for anyone, or? Thank you.
Hi everyone, my name is Jace Ferris and I'm the Homeless System Response Hub Coordinator for Hancock and Washington counties. I'm employed by Community Health and Counseling Services, but I represent both Hancock and Washington counties and all of the homeless providers throughout the system. My main job is to try to get resources together. So I work hand in hand with most of these people in this room and try to gather data to take back to the state and improve our homeless system. So feel free to contact me if you need.
Well, hello, everybody. My name is Joe Gattano, Vice President of Operations for Northern Light Health, Hancock County. We oversee Blue Hill Hospital and Maine Coast Hospitals and all the physician practices and clinics in Hancock County. First of all, I just want to thank everybody for pulling this meeting together. It's really, really important. As you know, probably, that housing and health are closely linked. And folks that they face a lot of social determinants of health and have poor health, they seem to be, when they're in a housing crisis or homeless, their health tends to be worse. And the conditions certainly are worse when we see them. We are an acute care facility here. We have 2 emergency departments in Hancock County. And we see, a fair number of the patients that are exposed to the, or population are exposed to the elements and don't have proper care on a regular basis. And they end up in our emergency departments. And so we're not a behavioral health hospital, although we get a fair amount of behavioral health crisis patients that we see, and they end up checking into our hospital. We have a very difficult time moving them to a better place for their care other than an acute care hospital. So that's one thing I'll mention. We work closely with all the community partners, and we're very grateful for our community partners here that work with us. And we're very grateful for the Ellsworth Police Department, who we work with very closely, and they come to our aid quite often in these situations. So, our biggest challenge around this is, I think it's the behavioral health aspect of many of the homeless. They come to us when they're in crisis, and most time they don't mean to, but they end up kicking and punching and biting, and we've had some pretty tough situations, and we're very grateful for the police department who ends up helping us out in these situations. So it's really tough. I think once we get them and we get them cared for, we're not a long-term care facility, so we have to move them out to create room for other patients to be able to come in and get the acute care that they need and the emergency care. So housing is, discharging the patients is a huge challenge for us, and trying to find out, where is a more appropriate place for them to go when they don't have a residence to go to. In addition to that, transportation is another problem for a lot of homeless. As a lot of our partners know, a lot of times the patients will arrive by ambulance, and they've got no way to leave once they get to us. And there's, maybe they don't have anywhere to go, and they certainly don't have anybody to take them there. So we work really closely with the community organizations. We rely on them a lot to help find a place for the folks and to get them transportation. So that's a huge problem. When they're stuck in our hospital, it's not a good place for them. They can be often very disruptive and to the care of other community members that are trying to seek care there. So it's definitely an issue. What do we need in the community? We need more support for our police department, who, my goodness, they walk into these situations with these patients in crisis, and there are some real challenges. They do a wonderful job, but I can see that they could probably use they could benefit from some help. So supporting them is huge. Supporting behavioral health in the community to create a situation where the people get the care they need prior to going into these crisis situations. So think about community-based behavioral health clinics, and health clinics generally would be a good thing. Transportation across affordable housing, as some of our colleagues have already mentioned, is a big thing. So I'll answer any questions that anyone might have, or Janet Lewis is with us from our Community Affairs Group. Anything to add? Okay. Thank you.
Thanks.
I'm Tracy Crossman, and I'm from Healthy Acadia and Inspire Recovery Center. So Healthy Acadia has multiple programs to support all of our community. But like what I work with is the most vulnerable. We have a recovery center during the day and then a warming center at night. Monday through Friday, we're open 23 hours a day. We try to be, we're more recovery focused during the day, but that, a lot of times that carries over. These people don't have anywhere to go. We provide a safe space for individuals to be nourished and warm during the cold winter months. We also offer resource navigation to connect them with other organizations and things that they need, like the food pantry, housing vouchers, primary care, MAT providers, substance treatment, mental health providers, main care, EBT, GA applications, rental applications, resumes, employment, transportation, like anything that they need is what we try to connect them with. I think the barriers that we see is lack of mental health treatment. I think the majority of the people we have this time of year is some pretty severe mental health. And again, like everybody says, lack of affordable housing. So I think that's it. That's kind of the overall. Oh, I do want to say, so the big increase, we've seen a huge increase this year at the warming center. Last year, over the time we were open, I think we were open the day before, a couple days before Christmas till April 30th. And we served 77 unique individuals. No, sorry, 91 unique individuals. And it was 1,277 cumulative stays for the 5 months. We're already at 77 unique individuals this year. And we're already at 1,004 bed stays. So we're gonna far surpass last year's numbers. And we're full most every night. Last year, we never filled up, but we're full now. Thank you.
Hi, Hi, I'm Kelly Cochran, and I work at East Maine Development Corporation in the Workforce Services. And I came tonight to listen and support and thank many of our great partners here. But I do think it's worth mentioning that many of the referrals we get for folks who are interested in entering the workforce, re-entering the workforce, or moving up in the workforce aren't really able when they are thinking about where they're going to sleep and housing insecurity as well as homelessness. So the ripple effect, I did just want to mention that and thank all of the partners here tonight.
Hi, I'm Tnie Jacobs. I'm the Supportive Services Director for Down East Community Partners. As the CAP agency, we address a number of the key barriers like safe, affordable childcare, heating assistance, financial resources to help people maintain the housing that they've already fought so hard to get. Lots of resource coordination like Tracy and her team. And we also have 5 units of housing, but they're in Washington County. A trend we're seeing is the choice of where people want to stay is being taken away from them. People want to be in this area, they want to work, they want to live in Ellsworth, but the only place they have to go is Eastport, where the jobs are not paying as well, their support system's not there, so that's really sad to see often. But I'll take any questions if you want.
I think we're crossing over now.
My name's Sarah Lesco. I'm the director at the Ellsworth Public Library. So I'm, like Kelly, here to learn. We face the homelessness problem every day, daily basis, when we're trying to run a library. Our biggest barrier to serving people is just not knowing what we can do. So we pass along our little resource sheet, and we can send them to Tina or send them on to one of you, and it makes us feel a little helpless, but we do the best we can, and we try to, some days it's just we can be a kind listening ear. So it's great that we're doing this. Thank you all for being here, and we're trying to do the best we can.
Good evening, councilors. So first, I'm Dale Hamilton and part of Community Health and Counseling Services. I know I'm breaking the rules because Jace has spoken, but I did want to elaborate on a couple of other resources that we provide in the community. But a big thank you for you hosting this. I think the most important thing we can do as a community is talk about issues like this to figure out how we can be a part of it, of contributing to it, and everybody that's here this evening to talk about that, because this is a significant issue, not only for our community, but as you've heard, it's a statewide, it's a national issue, it's a growing problem, and we need to have different solutions than what we have in place currently. So as our organization, we have a variety of services. We have treatment services available, mental health, substance use disorder treatment, as well as a PATH outreach program. The PATH is a program that's targeted specifically for people who are experiencing homelessness, with the goal of trying to work with the individuals, overcome the barriers, and move them towards housing. And what you've heard already is access to housing. I know as a council, you already started to talk about that. That's a complex issue. There's lots of factors around that get in the way. I won't go on this soapbox right now because we'll get into the discussion maybe later. I'll talk about that. But I think that's important to understand that this is a complex issue. It is not a one-size-fits-all solution either. The people who are experiencing homelessness vary greatly in terms of their needs, who they are, what resources they have. And then I'll leave with this. It's also not only the people who are currently experiencing homelessness, but there's a large number of people who are literally one paycheck, one rent payment away from being in that situation. And that's a looming issue as well. So thank you again, and I'll sit down.
Front row now. You guys.
Yes, all right. Hi, I'm Clyde Cushing. I'm the co-president of Loaves and Fishes Food Pantry. And our main goal is to help with food insecurity. We provide a supplemental food to pretty much anyone that wants it in the greater Hancock County area. That being said, if people come from Washington County, we don't turn them away. You know, we do have a few people in those fringe towns, Cherryfield, Millbridge, whatnot, that come. We don't turn them away. We don't turn anyone away. I would say probably one of our biggest challenges is our usage has nearly tripled since we moved into the new facility. We used to consider 40 people coming on a night that we were open a big night. This morning we had 118 people come in, and that's average now. And so we're serving between 400 to 500 people a week. So that need is just has gone up and up and up. And it's not just the people that are on assistance or the elderly. It's those people that are living paycheck to paycheck. They're working, but it's like, what can we afford to do? Do we buy heat or do we buy groceries? So we're there to help with that. And honestly, the biggest barriers that we have is money. 3 or 4 years ago, the vast majority of the food that we got was donated from Hannaford, Walmart, Shaw's, other places. We are now buying majority of our food. And as you know, we have good partnerships with Good Shepherd food banks and whatnot, but that's expensive. You know, we're spending anywhere between $15,000 to $20,000 a month on supplemental food that we just give away, and all of our funds are raised by fundraising. We have zero state aid. You know, what we get from the towns when we come during the town warrants are pretty much all we get from any municipal government or any government entity. Everything else is fundraised. So that is one of our biggest barriers. The other part that makes it hard with the homeless out here and the unhoused, they gotta come in, they gotta fill out a form. Most won't come in and do it. They come in, they fill out the form, we'll give them a box or a bag of food. And it's just a matter of having them come in and do it. That's probably one of our biggest barriers.
Clyde, sorry, just hold yourself.
Yep.
Did the food donations from those large grocery stores decrease, or they just couldn't keep up with the?
They decreased. Starting in COVID, they decreased, and we just can't keep up with it. I mean, we used to go and we'd fill a box truck, we'd fill a pickup van full of truck. Now we might get, 6 or 7 boxes instead of filling it to the rim. Sometimes having to make 2 trips we used to do, we're not getting that anymore. And what we are getting, a lot of it, unfortunately, we have to throw away because it's no good.
Let me see if we have anybody on Zoom who's representing organization. If you are representing an organization, could you please raise your hand and I'll let you hit you to speak. Shayna, I believe you're the first to do so.
Hi, I am Shaya Fraser. I'm the Executive Director at Families First Community Center. Most of our families that we're working with are coming from Ellsworth. We have 7 subsidized apartments, so we don't have a huge capacity. But we also have an outreach program. I believe we served about 148 families on an outreach basis in 2023. So we're not ideal for emergency shelter. We serve Hancock County, but we have and do help families in other counties. We don't turn them away, but we don't expend funds on them necessarily. The funds that we do spend on families that come to us on an outreach basis are typically spent on fuel assistance in the interim, but before they can come in to see Tina, homelessness prevention, so paying for a month of rent, putting people up in hotels before they can get into a bed at Emmaus, tangible items, for housing. Sometimes we help with bills after a catastrophic event like a death in the family. We do have Debbie, who is our outreach coordinator, and she helps people secure housing and fill out applications, and she has been successful in securing some housing. One of the biggest barriers we see is that with us, where we're offering the subsidized housing, people cannot have a criminal history, and they also have to be willing to follow through with program requirements. We are working closely with the city of Ellsworth right now, applying for the community development block grant with the state, which will make our outreach program much more robust, and we'll be able to help Tina and the city a little bit more. So thank you, Tina, for everything that you do, and thank you to the city of Ellsworth for putting this workshop on. The residents that we have, it seems like it's impossible to, so to speak, discharge them because there's no places for them to go. The problem I think that we're facing is complex and it's multi-layer. And it's not just an Ellsworth problem, it's a nationwide problem. Like one of the other gentlemen said, there's so many people that are just one paycheck away. So if somebody got sick in the family, I mean, they're that close to being homeless. We're seeing that rents are harder to find. There's no affordable childcare. There are a lot more roommate situations where people are renting out rooms, which is not ideal for large families. People are living in tents, campers, hotels. There is sometimes a stigma associated with staying in shelters. Rents are $1,200 to $1,600 a month. It's just not affordable. We see a lot of domestic violence and addiction, separation from spouses, different catastrophic events, loss of jobs, loss of one paycheck. People are, at this point, sadly enough to say, they're kind of set up to either be low income and have things or be just at that level where they can't get anything. So one of our residents currently has 180 days to vacate our unit because she got a $2 an hour raise at her job, and she has nowhere to go. So I guess that's all I have to say. We are accepting new clients for case management. If any of the PATH workers have a list of people that they can't accommodate, we are accepting new clients for that. But yeah, that's about it, unless anybody has any questions.
All right, thank you. Anybody else online? Going once. All right. Oh, Nicole, let's get you on.
Hi, everyone. I don't think I have a way to turn my video on, but hopefully you can hear me.
We can.
Yes.
Okay, excellent. Well, I just wanted to thank you all first for hosting this special workshop because I know it's an issue that's important to so many people in our community, and I think it's been really great for me also to be reminded of the resources and all of the organizations that are really contributing to solving this problem. So I just wanted to chime in really briefly with sort of some of the longer term initiatives at the state level. And the biggest one really is a law that we passed last year to create a Housing First program in Maine. And this is something that's happening in southern Maine right now, but we are putting a lot of money toward having these opportunities around the state. So Housing First is basically a place where a person who needs low barrier housing can find access to housing, and on site they have access to supportive services. So it could be things like substance use disorder treatment, helping folks, figure out how to apply for jobs. There's just a lot of opportunities because we know it's a multifaceted set of problems that folks experiencing homelessness are struggling with. So that's the good news, is that we did pass this law and it is funded, but the update from state government is nothing moves as quickly as we'd like or as I'd like, and so it's probably not going to be until 2026 that the earliest units are available, and maybe not till 2027 based on how long it takes to get the funding, amass enough funding, and then also actually build these facilities. But I just wanted to let you all know about that because it's going to be really important that opportunities like this not just be concentrated in southern Maine. And so I think if it's something that the city is interested in working on or thinking about regionally with other communities, I think there's a lot of need, as you've heard already, to think about creating a facility like this in our area. And I think it's really similar to some of the organizations that you've heard from who are doing this from a charitable perspective, like Families First, as a nonprofit. And so it'll be really good to be able to complement the type of services they're providing with something like the Housing First initiative. So I did want to just let you know that it is a front and center conversation for us here in the state, and we are trying to make progress on the problem. And as you probably know, the state budget is helping to fund some of the emergency housing opportunities like what Healthy Acadia shared with you earlier. So I'm not an expert in this policy area, but I am really just glad to share some information. I'm happy always to answer questions or ask folks who work in housing here in state government full time to try to work with our community. Thank you.
Thank you. And then guys, have you both lower your hands on Zoom, so if you want to talk later, I'll know. All right, so Tina, do you have anything to add in response to anything you heard, or?
No, not at this moment, but I might have a few questions for a couple agencies.
Okay. So next question is, what additional resources might help you to overcome these barriers? We've heard a little bit, we discussed about funding or decrease in donations, but if there are targeted, everyone wants more money, but if you have like targeted ideas on where that money could come from, where you would like to see more money specifically going, as you came in, hopefully I was able to give you the kind of the flow chart, focusing on some of these additional services that can be provided or that you all already provide. If there are just certain topic areas within that that you think are not getting the attention they need, just please feel free to come up to the podium and start to address that.
Sort of directly and indirectly, I noticed there's not a shelter on here, and Ellsworth could get out of some of this challenge by having a low barrier shelter in its city. A low barrier shelter is a non-qualifying shelter. You don't have to be program compliant. You don't have to be sober. You don't have to, you can be on the sex offender registry. The shelters we have in Ellsworth are, we're still low barrier. We take pets. Contrary to news articles recently, we do allow pets in our shelter. We've had a horse before at a stable. But I think the tents that we're seeing, the problem with our shelters, the ones that we're running, there are some barriers for people. You can't actively be using in the shelter. You can be suffering with use disorder, but you can't actively be impaired because we have children in the same location. We've moved some shelters around, and we've designated one of our shelters, the one in Orland. In hindsight, I kind of wish I did that for Ellsworth instead. But Ellsworth is such a great shelter for families with kids because of the school system and just the accessibility to resources. And I have more staff in Orland, so the lower barrier shelters require more staffing. There's more overdoses, there's more ambulance calls and all those things, and I have a stronger team in Orland than I do Ellsworth. But I don't know if any nonprofits eventually come to the city with proposals for things like that. I think it could solve some problems. We have, the last point in time count said we had about 8 people in tents. It's more like 20 to 40. One low barrier shelter with 40 beds could solve that problem. It is a solvable problem, but it really will take an agency to put a shelter like that up. We have applied part of what Senator Grohowski was talking about. Some of us testified for that bill, and that will provide some crucial supports for more people. What's happened is we've put people in housing without supports. They get evicted pretty quickly, so that'll make a shift. But I just recommend consideration if a shelter, I don't think it will be our shelter. I'm very short-staffed. I don't have enough money to run a traditional shelter, let alone a low-barrier shelter. I was in the State House yesterday testifying. Our budget's $500,000 deficit. The low-barrier shelter in Bangor has a $2 million deficit, and it just costs more to run. It costs about $80 a night for us to house somebody. We get reimbursed, or not reimbursed, we get funded, perhaps $13 to $20 a night per person. So Home, Ellsworth, and Maya Center can't get to low-barrier. I don't have enough staff, and I don't have enough money to have enough staff. But certainly something to consider if a proposal ever came to your table. I think that could solve a lot of challenges right here in Ellsworth. We have a small amount if we catch it within the next couple of years. I really think with this team that we can get a hold of this. I know that didn't directly answer your question,
It did.
but
There were two things I got out of there for
yeah.
resources.
So I'm going to make a couple comments that may be surprising in terms of from a service provider perspective. And that is in terms of what I think municipal government can do, state government, is we are not tackling the problem. We're working around the edges, and we need to. And we need to have resources available to help people. But the answer in terms of, or I guess the starting place, I think is the question is, do people deserve to be able to have housing? And should anybody be living unsheltered anywhere in this state, in this country? And if the answer is no, they shouldn't, they should be able to be housed, they shouldn't have to live unsheltered, then it really is about bringing resources together to talk about how we move it forward. And so some examples and some things that I would just throw your way for your future discussions are things like ordinances and requirements. Ask the question, bring in some developers and ask them why affordable housing isn't created. Why does it take so long? You just heard the comment about it. Well, it's going to be 3 years before we get affordable housing. Ask those questions. What are the barriers? The reality is that affordable housing, to develop it, isn't affordable for the developers to do. And if it's not affordable to build, it's not going to get created. And some of the restrictions around that, when you start to peel back the layers and you start looking at some of the regulations, are those regulations really helping or are they hurting? Do we really need to impose certain requirements on those development to bring those forward? Does the funding, if the funding exists, why does it take so long to get to the developers to do the construction? If we don't have housing, we can't solve the problem. And what we end up doing is putting a lot of resources. Shelters need to exist, but it would be ideal if we didn't have to have shelters because we had housing. And we're not going to be able to do that. So we're going to continually put money into these resources that doesn't get at the core issue. So that when I'm, for you, what can you do? I think it's asking those questions. It's pushing, bringing the state, asking, it's not a state, it's not the legislature's fault. It's nobody's fault, but it really takes some leadership in terms of bringing people together to have a different kind of conversation to move this forward. There are many, many barriers that are not going to be resolved in 2 years, 5 years, 10 years. Workforce is a major issue. Funding is always an issue. Workforce isn't going to change. So we've got to think differently. We've got to do things differently and start solving the problem to move the issue to a place where we actually solve the problem. We don't just talk about it and work around the edges. There's a lot of things that can take place. And so I would just encourage you as local government to ask those questions, to bring developers forward, to push the state, keep this conversation going. But you don't have the funding. You're not going to be able to fund all of our organizations to do the work. So I think about what you can do and look at the ordinances, look at things that you can do to create housing. Short-term rentals, I know that's been on your agenda, on your topic. Anything that takes housing away increases the cost of housing. It's one of the problems. So there's a lot to it, and I just wanted to throw that perspective your way. Thanks.
Hi, I'm Paige Johnston from Healthy Acadia. I just want to talk about a little bit of what we see at the overnight warming center. Some of the people that are coming to us really are outside of our scope of service, but we are keeping them because otherwise they're going to be outside. But the expectation to use the service really, even though it is low barrier, you still need to be able to like go to the bathroom and keep up your own hygiene routines and things like that, be somewhat self-sufficient. And we're seeing folks that because of physical and mental disabilities, many of them are older, they're not at that level. And so we're working really hard to try to connect with other agencies, but part of the barrier we're seeing is that there are no nursing homes to send them to, and there's like a lengthy process. You have to get a Maximus, and all these steps go in to even getting them to be able to access those services. And then once they can access them, then we're scrambling to try to find open facilities, open beds, and then often they'd have to move away from where their support services are, you know, outside of this area. So that's just sort of an adjacent issue that we're seeing a lot of, the same, you know, with availability for group homes for people with serious mental illness. That might not really be a great fit for a shared living space where you need to be able to self-regulate. You know, there's a lot of additional needs that could be supportive. Also, I know we have some great public transportation systems in place in this area, the Down East Transportation and the West Bus goes through here, but additional services to get people to the food pantry or to appointments, just sort of inner, you know, within the city, more accessibility for those, I think would help people to be a little bit more self-sufficient and get their needs met. And obviously, as many people have said, public housing, low-income housing, and working with our landowners around here that might just have an extra, you know, couple of units that they're renting to supplement their income, to help them have maybe less stigma around, the folks that do anyway, have less stigma around renting to people with housing vouchers, because there's actually a bunch of folks that have jumped through all the hoops to get a housing voucher, a BRAP voucher, or Section 8 or whatever. It takes quite a bit of paperwork and follow through and providing documentation. But then once they have the voucher in their hand, they have a pretty small window of time to find a landlord that will accept it. And oftentimes the vouchers are expiring and they have to start the process all over again because there's just, we don't have a housing situation in this area right now where landlords are willing to do that and take the lower cost and meet all the regulations that are required to be a Section 8 or whatever landlord. So, thank you.
No one from here. I see Shayna. Let me let you. Does that work, Shayna? All right, Jesse, I'm gonna allow you to talk.
Yes, hi. Thank you to everyone for coming together on this very important topic. My name is Jessie Salah, and I am an intern from UMaine's social work, Master's in Social Work program over at Families First Community Center. And there are some creative ideas that are more temporary that have been institutioned in other countries and in other states. One such program is a sleep pod construction that houses two people some belongings. And they're doing this in Germany. I can certainly post a link. These are just inexpensive temporary solutions while we are looking for more funding. They do have keep people out of the elements, and I think those are some solutions we could be looking at. And I just wanted to touch also a little bit on policy, in that some of these policies that have been put in place that are creating barriers are outdated from the 70s. And I know that's not something that we can address here today. However, I think these are the types of things that we need to be bringing to our state house and to our senators, to our governor, and getting them to higher places in our government, because the income requirements for, as Shana was saying, we have, somebody making $2 more an hour not being able to qualify for low-income housing or for Section 8, when the rents are, between $1,200 and $1,600 a month. It's very disheartening when you have people who are doing all of the right things, and they're not getting anywhere. And they're actually being penalized for doing all those right things. So I think that one of the things that we need to look at long-term is really gathering. There's a lot of people here today looking to find funding and make things more available and more doable, and really joining forces and bringing it further up the flagpole, if you will.
All right, thank you. Shane, I'll try one more time. If you want to speak, you can unmute. I think you're still allowed to talk. All right, doesn't seem like it. So, if no one else has any other resources to discuss, I guess just touching on what Jesse just spoke about, if there are existing collaborations or partnerships between community members or community groups, it might be good to put those out for the council to understand where communication's already happening, and where it needs to be improved, and ways that they can start to think about ways the city can help with that. So Janet, I might ask you to start with that, since I know.
Hi, I'm Janet Lewis. I work with Northern Light Health as their community health outreach coordinator. I wanted to tell you about a program that we have been working on with many of the community partners that are here, called the Medical Neighborhood Team Program. Excuse me. It comes together with organizations that are concerned about people and patients with complex needs, like we've talked about: substance use, homelessness, behavioral health, folks coming in and out of the emergency room. I hate to speak in public.
You're doing great.
Yay, that's right. We're not in public. Okay, so I know a lot about this team because I'm part of the coordinating piece of it. And what's important is that we're coming together to talk about how to improve communication. What is the capacity of each organization? What do we assume we know? What is real? What's reasonable? How can we make better referrals? So this has been going on for almost a year and will continue. And I think if there are other collaborations that we don't know about, that's a real strength, to get those people together, whether this group comes together like quarterly or something like that, but just sharing these resources, because we've made networking, what is happening? Sorry. We've had a lot of networking happening. A lot of good people are coming together and making arrangements to work together, like on the count is coming up. So that's a great project that we could learn from and bring information back to this council about how that's working, if you're interested.
Who is, so excuse me, Northern Light is the one behind the Medical Neighborhood Team program?
So Northern Light, Dr. Murnick and myself called the meeting as a result of meetings that I was having individually with different organizations who were saying, hey, what happened here? We had a situation there. Who do I talk to? And my position is to build relationships in the community. And so being out, I'm hearing stories that we need to be talking about. And who's making referrals? Like, how do we control or think more about who we're sending to the emergency room before we send them? And how are we getting people out in a way that's not disruptive to the organizations that they're working with? So we started it, but it's really a collaborative effort. It's a collective impact project so that everybody has the same concerns. We all have the same values, and we all want the same kind of positive outcome.
So are the organizations in this room tonight a part of that?
Raise your hand, like, yeah?
Ah.
Yeah. So it's great, it's a great project, so I'm happy to stumble my way through that description.
Yeah, no, that's great. And you said Dr. Mike Murdock was part of it?
Dr. Marnick is, yeah, he's
on
the
the board of
champion.
Healthy Acadia.
Yes.
And, yeah, no, okay,
Yep.
great.
It's great collaboration, and I apologize for my
No,
parent
no.
fear of speaking. Thank you.
Are there any others?
Yeah, I think Jace can finish what I'm starting, though. A collaboration that Jace put together just over 2 years ago. A group of us got together to see how we could better work together to solve some of, we've never seen really people intense. This is sort of fairly new, this number of people anyway. And so we got together, and that collaboration, I just wanted to just point out two things that happened. That collaboration, Healthy Acadia was jumping in to say, how can we help, how can we help? And they were fairly new officially into the homeless work. And out of that meeting, their warming center popped up. That idea for them came out of that. They said, what is the biggest need now, today? And we were like, desperately, we need somewhere for people who are struggling with use disorder and severe psychosis to be, so they don't freeze to death. So that happened because of that. And then we've had some incidences where, with the medical neighborhood group, that we've had law enforcement pull people out of some pretty horrendous crisis and bring them to our shelter. Our shelter's not really equipped to handle the situation, and the medical neighborhood group helped us patch together services for a family that we couldn't serve well, and for lots of reasons I can't go into why, but the medical neighborhood group helped our shelter be able to facilitate those situations. And another group that I'm a part of that may work in the city of Ellsworth, every month I meet with Bucksport PD, city manager, the Bucksport Regional Health Center, and we talk about hot topics. It could be substance use, it could be homelessness. I give them the data of how many beds I got open that month, or anything that's happened. I talk with the chief of police about situations that we could be helpful for. We started it with COVID. It may be something, I'm not sure of your bandwidth. It's a bigger city, lots more time on your, lots going on with you guys. But that may be something as well that may be helpful. It's been really helpful for Bucksport PD, and I'm not sure if you want to reach out to them to get a sense of how that's helped us as a shelter provider and the city of town of Bucksport. Sorry, no, yes.
I just wanted to elaborate a little bit more on the meeting that Tracy was talking about. I facilitate a weekly, what we call stakeholder meeting. It's where our local resources gather, and the shelters will say, you know, I have 2 meal beds, or we're full today. We have Healthy Acadia that comes and they'll share like their warming center updates if they need anything. I have a huge resource list that we can send out if anyone needs anything throughout the week or whenever. And also if like the hearings that took place yesterday, like if there's something big like with the legislator, we can like send that out and try to gather some momentum with our local providers. So if anyone is interested in that, I'm more than happy to get someone my email address and we can connect you to it.
Jason, if I may, so you said you work for the state of Maine?
No, I work for Community Health and Counseling Services.
Community Health and Counseling, okay, I'm sorry.
Yeah, they sign my checks, I guess. But we're meant to, like, the hub positions are meant to be not, like, represent anyone. We represent the hub that we work out of.
Okay. All right, thank you.
Welcome.
I just want to mention some like partners that we have that support us. So we have Northern Light, like their kitchen provides some food. St. Dunstan's First Congregational, they both do their weekly meals and they provide us with 20 meals for nighttime. EPD with the safety checks and support when we have to call them. AMHC Mobile Crisis, they provide a lot of support to guests. And then, of course, the meeting that Jace mentioned and that Janet mentioned. We also have the Down East Housing Collaborative, which is a group of 17 community partners across Hancock and Washington County, and they're focused on health-related social needs. Then, of course, I work with Tina very closely and often. Then we have some landlords that I've been able to kind of slowly build a relationship with and been able to house a few people, just not enough. And then Healthy Acadia also purchased a home in Hancock County and has 2 rentals that accept vouchers as well. And we purchased one in Washington County as well.
Tracy, I actually have 2 questions for you.
Sure.
Could you just describe what a mobile crisis team is that AMHC
So you have, you can call the 800 number, but we work very closely with, so that's the main crisis line. But we work closely with Ashley, who directs the crisis unit.
All right. And then my second is, when you work with these landlords to house people, what does that education for the landlord look like? And, is it more just trust building, or is it more educational?
I think it's just been more trust building so far. I do think that it's important to, maybe build a program where we're educating them. I just, with what I've done so far, I haven't had to do that. And I totally just lost what I was going to say, but anyway. Oh, I think someone mentioned it earlier. Tracy, I think, mentioned when people get housed quickly and then there's no support, and they've had all this support leading up to getting housed, and then they have none, and then it leads to early evictions or whatever. I think it's very important to build some sort of a program where we're following these people and working with these people so that they can stay successfully housed.
Thank you.
Is that like behavioral health, counseling, social workers?
Well, I think it could be many different things. You might have some people that need more mental health type, counseling and services, but you might just have somebody that just kind of needs a little hand-holding to, to make sure they're checking their mail and they're signing up for their voucher, or, like doing the work to keep it, I think it'd be a wide variety.
I think that's a brilliant idea too, with folks from the warming center, because the shelter system has that embedded in the contract. So we, when somebody leaves shelter, we stay with, as long as they're willing to let us, we stay on there with them for up to 2 years. A lot of people don't want anything to do with us after a few months. But it's things like, you can't rent your washing machine out to your neighbor. Just how to be a good tenant. A lot of people haven't had exposure to being tenants. And so it's really, it's been successful for people. We had about 50% of people exit the Ellsworth shelter for permanent housing who didn't come back into homelessness. So that's a shift. So the recidivism from that model, I think, would be brilliant with your work. Because if we can sort of stop, it's sort of like drinking from a fire hydrant right now, this crisis, but if we can do homeless prevention, good homeless response, and then have a long-term plan as well, I think we can get a hold of this.
We implemented something a little bit with our rental, like something we call like a quarterly inspection, or, just something that you're keeping in touch with them and in the house. I mean, it's not exactly what I want for all of it, but, and I mean, so far we're fairly new with it, but I think it will work out okay.
Can I ask you just a couple more questions? I'm sorry.
Sure.
The first one, when you say you're building trust with the property owners or the renters, what is it they're looking for that you have to develop the trust? Is it support? Is it guarantees?
I think support, and I mean, mostly that's what I've found is just support. And maybe I have one that they were kind of new doing it. So I think just having us, you know, as a support person, and I'm able to follow up with some of them. You know, it's a pretty large community with that one. And then I've just had a couple other landlord, I mean, I had one that called me to say, I want to rent to someone with a voucher. I wish those would fall into my lap. I was like, what? And then one that I just kind of know a little bit. I mean, she's only got a couple units or whatever. So I think, I mean, there's a lot of work that could be done with landlords. It's just, I guess, finding them and them being willing to do it.
So I'm assuming there's a fear of doing that.
Yeah, I think there's stigma with someone that has a voucher. And like they mentioned earlier, the rents have gone through the roof, so what the voucher will pay is nowhere near what these people are asking for rent. It's crazy. It's a lot. You know, so you've got a few that are, you know, that do, but not, you know, not very many. I mean, I've probably housed in the last year, I mean, permanently housed, I would say probably under 10. I should have pulled that together, but.
There's not a lot of rental
No.
inventory, even for people who
No.
could afford the rent.
Oh, absolutely.
There's no inventory.
Yeah, I have people that, I mean, they work, they wouldn't even need to rent with a voucher, you know, they can't find rents, you know, and then the price.
The vouchers themselves are state funded, these are state subsidy vouchers?
Yes, I mean, I work on just the application part, I don't approve them or anything, but there's like BRAP, Section 8, and Shelter Plus Care. BRAP and Shelter Plus are like community health and counseling.
There's a shelter,
vouchers.
one voucher that's specific to people who, the qualifier is you have to be in a homeless shelter. It's called the Home to Stay voucher. And so most of the people that are leaving our shelter here in Ellsworth are leaving on a Home to Stay voucher, which is a little different than the BRAP voucher, which require, the person has to have a dual, is it correct, a dual diagnosis?
For BRAP, you just have to have mental health.
Just
Right.
a mental
They have
health
to be on the
diagnosis.
Section 8 wait list.
Right, you have to-
And they have to qualify for Social Security.
Right, they have to be applying for or receiving disability.
The thing that Tracy did so well last year, I was so impressed with the landlord engagement. Landlords have really taken it on the chin. We have 18 units ourselves, and they're high-use buildings, you know, they're lived in hard, and we recognize that with the folks that we're serving. And to have that person, a landlord can call, because oftentimes the old system used to be that a person would get into housing, and then the landlord's kind of alone with this person who has a lot of crisis. And so Tracy is sort of like that middle person where the landlord has somebody to call as well for support for the landlord. And the state, and I don't know if Senator Grahowski's on here, but have talked about some landlord incentives. If a window gets broken, perhaps that money could be replaced. The fund we have at home and Emmaus is we have a diversion program where if a tenant is about to get evicted and it's because of property damage, we could afford, if it's within a certain price range, we could help that landlord fix that repair if the landlord would agree to give this person a second chance. And so that's a lot of that happening now. I think 84 families last year were prevented from coming into shelter through that type of work. But Tracy really hit it out of the park. I was so surprised. It was amazing with the hotels. Yeah.
And I think there are incentives too with the main program for first-time landlords willing to accept it and do it the first time if they've never done it before. So if that's another incentive that they have. And if I got to say, we do have 3 supportive housing units for DV survivors too, but they're usually full here in Ellsworth.
So the units, the 17 that you have, the 3, and I think DCP has the number in Eastport as well, those are built or maybe purchased with the expectation that they would always accept vouchers?
Yeah, our contract is you know, one of them out on the Surrey Road, the Barbara Hans house. So that's contracted in perpetuity. single room occupancy. We're about to build another unit under what Senator Grohowski was talking about in Orland for families with kids. That should feed from the Emmaus shelter. That's our goal, and we've got an architect that's in planning. We're going to start a capital campaign and do some fundraising. We're hoping to break ground next year. That will be permanently subsidized or vouchered. We run ELS if this will accept vouchers, but we'll also subsidize for working poor who don't qualify for vouchers. Because otherwise you're not stopping the flow into homelessness if you don't sort of approach it systemically. So we have one unit in Bucksport, it's 7 apartments. We charge $500 all included, no subsidies. And they're usually single adults, there's one unit with a couple.
So the 2 units we have, Healthy Acadia has, we specifically got those to accept vouchers as well.
That was funding from Main State Housing.
And ours are, we have 2 with vouchers attached to the units, so they can come in and use vouchers there. So our supportive housing units, they can continue to stay there long-term, so that's why they don't free up very much. And we have one of those units that doesn't have anything attached, that can be more flexible in the funding that we accept for it, but they are fair market value rates.
Have a tough time hearing people if they come to the mic. Okay, good, please. Thank you.
So I just fill in a little bit on the vouchers, just a couple other pieces to it. So with the BRAP, Bridging Rental Assistance Program, and Shelter Plus Care, one of the things that the landlords are required to do is that we have to do a housing inspection. It's not a code enforcement, but it is a housing inspection, and so there's a little bit higher level responsibility that landlords have to take when they accept the vouchers. So it's not just the taking the voucher, it's also meeting the standards and being willing to do that. We're currently piloting a program. Unfortunately, it's not in this county, but it speaks to the issue of supporting landlords. And what we have some funding to give some monetary support to landlords to deal with whatever comes up. And the reality is that in some situations, landlords have faced the reality that they've had to move towards eviction. That is not a process that is quick. It's not a process that is easy, and it's not a process that is cheap. And so anytime that a landlord ends up in a situation where they have to evict someone, it doesn't make that landlord really wanting to participate going forward. And so that supported housing really is a critical piece. And this program that we have not only provides that financial resource to say, you know, take the risk, because we've got some resources that can help maybe the damages or whatnot. On the front end, there's an incentive. Just by signing up, they can receive a payment and support. But the most important thing that we've heard is that support the case management. We have somebody that is connected that can work with the landlord. And so if there is difficulty, something's happening, early intervention, working collaboratively to solve the problem, to get the resources, that's what's really needed. And it benefits not only the landlord, but it's benefiting that individual. That person is then able to work through that challenge that they're having and to be able to remain housed. And so that is an important piece. There's lots of different ways that happens in the system, but there's no one system of supported housing. That model has changed over the decades that I've been providing this. There used to be a program, now there isn't, and so it is an important part of the process is supporting landlords. But just wanted to fill in some of the gaps around that.
Dale, I have another question for you. I know I'm asking all the questions, and I'm sorry. But I know that, because I was on the board of Down East Community Partners at one time, and I had to give it up when I ended up working in Bangor. But we used to have a lot of really great services, and we'd start them up and we'd build apartments or something for veterans, and then the state or the federal funding would just disappear, and then they're left to have to kind of try to find the funding, or all of a sudden you have these great services, and then you have to tell everybody, sorry, your services have to stop because the funding is stopped. So with Senator Grohowski on here, I just want to know, is that, I mean, that was probably 8 years ago that I was on the board, but is that funding taken more seriously now that the state is helping with the federal government? Or are we still in this, we have all of these great collaborations, and you're saying we have funding for this, and Senator Grohowski says we have funding for this program for the state, but if it doesn't even open until 2026, is the funding even going to be there when it is available? So that's why I know if that's something that, as in the collaborations, that we do a lot of talking in the state legislature and even with our federal representatives. Can you?
Yeah, I mean, that's a loaded question in some ways, just from the perspective of funding is always an issue, and the reality is programs are always changing. And so in state government and federal government, the fact is that every administration will come in and every administration will have their own perspective about what to tackle. Every legislature will have their own issues that they're facing. And so that's a constantly evolving process, and that's the advocacy that takes place all the time. And so it kind of goes back to what I said earlier, is that there's a lot of funding out there. There's a lot of gaps as well. And funding alone is not going to solve this crisis. It just isn't. There isn't enough funding to solve all the pieces. But what we can do is start thinking about how do we allocate that funding? Where do we need to put our focus and our attention? What are the things that we can do that doesn't cost anything that could move the needle? Those are the kinds of discussions I think we need to have. We can't just keep talking about give us more funding, and stand in front of you and stand in front of the legislature, because at the end of the day, there's still going to be gaps, and we need to move it forward. So I think that's why I said having a conversation is great. It's the next step in terms of how do we move it forward, and not just think in terms of, well, funding. If we stick with funding, it's never going to get solved, because it's always an issue. It's always changing, and that's kind of, I think, all of our roles is we're always looking to try to find the funding. But I think leadership in terms of local and state and federal government, that's where things can really change and evolve. And I hope that that's the one thing that you take away, is the advocacy to take it beyond the municipality. I don't think it's a municipality's problem to solve alone. I think it's the municipality to advocate, to say, let's do something as a state and change the system.
Thank you.
All right, we are nearing the end, but Glenn, as city manager, I don't know if you want to talk about the law enforcement piece. We hadn't really gotten too much into those services or piece of the puzzle yet.
Well, I mean, yeah, certainly over the last couple of years, we've seen a considerable increase in law enforcement involvement with people who are unhoused. We've seen, a significant increase in the amount of people who are residing in tents, and many times they're putting those up on private property, and we have private property owners who are contacting law enforcement and asking for their rights to be protected and their land to be vacated by the people that are residing on it. And oftentimes those removals come with difficulty because the folks have nowhere else to go. There's oftentimes a significant amount of mess that needs to be cleaned up, which is costly to the property owner. So it becomes difficult with those situations, and honestly, we know that when we move them from one person's property, they're going to somebody else's property, and so it's not like we're going in there with answers or solutions to their problems. We're just really compounding their problems by making them move, and oftentimes leave some possessions that they may have in those locations because they just don't have the capacity to move them. Some of the challenges that they're facing at the warming center, our officers are dealing with those people who have limited mobility issues, and they're residing in a tent in the woods. So I mean, you can imagine what type of barriers that creates for those people. In addition to those situations where law enforcement are interacting with those folks, as was mentioned earlier, the hospital becomes a pretty significant challenge for our officers. You know, most of the time they're responding to a scene at the hospital where this person's in full-blown crisis and oftentimes being combative and, you know, assaultive towards the hospital staff, and our officers are forced to immediately, you know, go hands-on with these folks and try to protect themselves, try to do as little harm as possible when interacting or when going hands-on with those folks, and trying to protect the nursing staff and the doctors and the other patients. You know, you're talking about an ED department that is not set up for mental health crisis. You have, you know, a mental health patient in a room where and right next door you may have a mother with a small child who's, you know, has an ear infection. You know, so I mean the dynamic and the mixing of the situation is just not conducive to really being beneficial for anyone involved. It's not beneficial for the folks who are suffering from mental health or substance use disorder, and it's really not beneficial to the other citizens who are there seeking medical treatment. So those are some of the biggest problems that we face as from the law enforcement perspective. I participated in those organizations. We met here and we talked about that warming center, and initially from a city's perspective and from a law enforcement perspective, you know, we have reservations about those types of setting up those types of support systems, because we recognize the need, but we also recognize that when we have that offer, when we have that resource available, it draws people who ordinarily may not come to our community. So, you know, what we've seen at Inspire and the Warming Center, which has been a godsend for people who need it, but, you know, we've seen people coming from, I don't want to use the word far and wide, but we've seen people come from areas that ordinarily their areas don't have any resources. So anytime you present a resource, you're drawing those people to you. And so what happens is that resource, as we've seen, quickly becomes overburdened, and it can't sustain what it's bringing in. So that was one of our concerns that we talked about in that meeting, and and the warming center with help from the city and code enforcement, and we worked very closely with Healthy Acadia to get that up and running, and it was successful, and there's no one could argue that it's helped many people throughout last winter, and certainly is continuing to help a lot of people out this winter. But again, it's a challenge. You know, our law enforcement response to Emmaus Center over the years, and now to the Warming Center, it tasks the capacity that we have to provide that response, the officer and man hours that are involved with situations, particularly at the hospital, when they have long time stays of mental health folks who they're waiting for a bed to open somewhere, and we have officers going back multiple times a day to interact with these folks and try to support the the hospital staff. So it definitely is a daunting task, and it definitely puts a strain on our resources as a city and as a police department. As an EMS department, our EMS providers are also responding to many of these situations. We work very closely with Ashley Pesic and her mental health crisis folks. But it's a situation that I've experienced my entire career with Ellsworth Police Department, and it's certainly something that over the last couple of years has increased significantly. I work very closely with Tina on almost all of her GA cases to provide her all of the support that the police department can offer to try and answer some of her questions and make some of her referrals and placements a little bit more reassuring, because as some of these other folks talked about, if you have somebody who is actively using or is volatile, you're not going to want to put them into a situation where they're going to be in a low barrier type of place with interacting with other people. So I know Tina and I have had a lot of conversations about I have this person and I could put them here, but it's really not a good fit. And I don't think they're gonna be successful, and they're likely to cause problems, and then it's gonna be a problem for us, it's gonna be a problem for that landowner or that organization that runs that facility. And so a lot of that type of thought process goes into how can we help these people in the best way possible with the limited amount of resources we have and try to be successful. So there's a lot of great collaboration in this room, but as has been stated many times, it's a huge problem, one we're not going to be able to solve, but I think through the efforts of these groups, certainly the city, and through advocacy, we can continue to move that needle and at least help our little small corner of the world, if not being able to have a bigger, larger impact. So.
Do you have anything, Tina?
No, I am.
I was just going to, there are only 5 low barrier shelters in the entire state. And so that, City Manager Mosher.
I'm sorry, good.
Yes.
I can hear you, thank you.
There's 39 shelters in Maine, and there are only 5 low barrier shelters, and that is a state problem. City Manager's correct. If we did have a low barrier shelter here, it would do that. Some shelters, I know Boyd at Bangor Area Shelter, I think their warming center now, your episode of homelessness has to originate in Bangor. And we had to do that this year in our Orland one, Bucksport Orland. We decided on a 6-town service area because we had to scale it to realistic capacity. And that's something we can't control what other nonprofits decide with their policies, but that is a conversation that I think can be had, and because there is that. I mean, I don't want to deny that. It is because there are only 5 low barrier shelters. So if you do put one up, Aroostook County, if they didn't have one and the Bangor ones were full, we would be the next one. So I think with good conversation, and I'm really glad you brought it up, I think in Ellsworth we could find a way to really narrow down to our service area and scale to capacity based on the numbers that Jace will start to generate through his role with the data collection. You'll start to have a sense of what's the scale of homelessness originating in Ellsworth. And keep in mind that data set comes from where did you sleep last night? So they could have been somewhere else a month ago, but it's the best we've got for data. But yeah, it's a really good point. But I think we could, with some conversation, we could work through that and have some zip code parameters. Others have had to do it for very practical reasons. Yeah, yeah. Also with law enforcement in other towns, we've often had to say no to law enforcement from 2.5 hours away, because when we don't want to encourage people to come to service areas where there's not enough supports. There's fewer jobs in Orland or Ellsworth than there are in Cumberland County, for example. And so most agencies that we work with don't tend to try and encourage people to come so far away from the supports that are closest to them, school systems and those things. So it's tough, but I think it can be worked through a little bit to make it more improved.
Tracy, is there a standard model of creating a new shelter? For example, a low barrier, in which is it the state builds it or a municipality?
There's 2 municipalities that run, well, maybe one now, just Oxford Street in Portland. And they never run out of, they've got more money than we do because it's funded by the municipality. I'm leaving this job soon, so I'm just going to say this. I think I'd be remiss to encourage people to open a low barrier shelter when the 5 in the state are struggling to stay alive. So it's back to what Mayor Beal said about, Chair Beal, sorry, wrong town. About the cliff of services. It's a very political environment, and in November we could have a very different scenario again, even with the vouchers. The the Victims of Crime Act has just been cut $60 million nationally. 6 million, sorry. And so for Ellsworth, that could mean potentially three outreach workers in the field and another shelter further south of the state. So it is
you know, it's tough. But we're doing the right thing by talking about it, I think, so we can all be on the same page. And regular meetings will keep us apprised of what's coming and what's going, I think, with funding, policies, yeah.
Thank you.
So I kind of have a question for the council. I've been kind of just sitting here just trying to take in information, and one of the things that Dale mentioned a while kind of stuck with me, that we are all working on the fringes of it, and we're not really kind of attacking the main problem. And then you had mentioned that there's 20 to 40 roughly living in tents now here in town?
No,
Or-
you know, thanks to Healthy Acadia,
Yeah.
that number has gone way
Way
down,
down.
and Jace will get the count next week.
So, my question is, what is there that the city has for property that is abandoned, not being used, that's vacant, that we could find some way as a city to use to make short-term rental or rentals for these folks to get them back up where they need to be as a city managing it? You know, is there a larger vacant building that we could use as a, not a low barrier, but maybe like a semi-barrier shelter to get some of these people started? You know, this could be the starting point, because, you know, not one of us is gonna be able to handle this on our own. I mean, there's a lot of organizations here that I think could contribute to helping make this run. And there are other organizations that if we were refurbishing something, I'm sure would be able to join in to help that effort. But I don't know, is there a property in this town? I know Councilor Halloran mentioned a whole bunch of them when we were talking about moving the police station. Are any of those still available? Or any of those a viable alternative? Have we thought of this yet? Or is this just already been thought of and said, no, this is not gonna work? That's kind of my question.
We're thinking about it now. I mean, as you're bringing it up, it's a great idea. It comes up every once in a while. We deal with putting properties out to bid, or realizing the council has to take them over to demolish them if they're a hazard to people. But we definitely see these properties come up on occasion.
A couple that come to my mind, the USDA building and the old Rite Aid. I mean, I know the old Rite Aid's probably is still a privately owned building, but nothing has been in there in over 2 to 3 years. It's in the center of town where it's access to a lot of services. I mean, I don't know if it would be something that we could explore, be worth, I don't know if the city wants to be landlords, but, you know, it may solve the crisis that we have right now and move us forward.
I would just like, the Rite Aid building is a privately owned building. The
Right.
city would have to buy it, and it's a multi-million-dollar building. And the USDA building is a federal building. But my fear is the city isn't equipped. We don't have the resources in our departments. I think it would definitely, if anything like this happened, it wouldn't be the city managing it, because we don't have that type of experience or education or resources to do that. But when you are talking about, like, when we have the tax acquired property, if there is a way that we can help advocate for funding, so another, you know, you could put up some more apartments or, you know, some things like that, that would be a great collaboration, I think, with the city. But as far as the city doing it, we just don't have that kind of a background or the resources to do something like that. But doesn't mean we can't help with it, you know, honestly. And I think it's a great topic that you just brought up, is, you know, a little more collaboration and advocacy.
So I can tell you, the city currently doesn't own any property through tax acquisition in the downtown area that would be practical, like those properties that you named. For the few properties that we do own are outskirts. They're a distance out, so that they're not real practical for people who have, you know, need easy access to the businesses and work and that sort of thing. I know that Jana and Matt, our economic development and planning, they've done some looking at and talking about a land bank type of situation where the city, and I only know a little bit of it because I've only had some conversations with them, so Matt can probably elaborate more on it, but a situation where perhaps city-owned property could be provided to a developer at a reduced cost, perhaps, if the developer was willing to build housing that was affordable, maybe, you know, that was willing to accept vouchers, that type of thing. So there are conversations within the city on ways that perhaps we can use some of our resources to help facilitate that through developers. As you know, Michelle adequately stated, we really don't have it's not in our wheelhouse as a city, and we really don't have the resources, the staffing to be able to develop and run, you know, housing for people in need. But I know this land bank thing is something that's been discussed and made perhaps something that we can move forward.
Yeah, and just to add on to that, using tax acquired property, particularly in Maine, has become a little bit more complicated recently due to a Supreme Court case, but we did look at land that was acquired by the city not through taxes, and there just really weren't that many. Again, that seemed to fit the bill, or like if we acquire property due to like a hazardous home or just abandonment, there just weren't actually that many properties in Ellsworth that the city owned. So it's something that's on our mind, and we were looking at maybe if land's not available, start doing some type of fund or a trust similar to what Brunswick's been doing. But how sustainable that is, we're not entirely sure. But it would just at least be some type of short-term action to, again, assist. It might not solve the problem, but it will at least assist the problem. But I see Nicole wants to speak too, so Nicole, I think you can speak. Just go ahead and unmute.
Thank you. I just wanted to sort of piggyback on this conversation and make sure folks knew that we did establish a redevelopment land bank authority at the state level, and the point of it, like what it literally says in the statute, is its purpose is to assist municipalities in the redevelopment of properties that are eligible to return the properties to productive use. So I think if it is helpful and the city does come across any properties, you know, it sounds like maybe there aren't many at this moment, but
we did look at this program.
That entity is there to try to help figure out what is and isn't possible. So for instance, because of the Supreme Court decision, if you're sitting on a property and you sell it for, you know, more than it's worth, you don't get to keep the money anymore. But the point is that there are ways to, you know, I think it's possible to take land that's been acquired and instead of putting it out to the full market, you can get what it's valued for. You know, you could sell it to somebody who would be willing, you know, with a deed restriction to put the right kind of property onto it. That way that property isn't developed for, you know, Airbnb, for instance. So I think there are a lot of options here. I'm maybe not being the most articulate since I've been in meetings since 9 a.m. this morning. But, you know, I also want to remind folks of the MDI and Ellsworth housing authorities. I mean, there are partners in our area that, you know, it's their role to help develop housing. And to Dale's point, I think, you know, part of the problem is once folks, and many people have said this, once folks are ready to get into housing, if there isn't housing available, then you get the whole system sort of backed up. So it's important to be thinking about the whole spectrum. And so, you know, some of this development of just sort of regular affordable housing is as important, I think, as talking about the other end of the low barrier shelters. And I just wanted to let you all know, I'm going to send just a brief document to Matt to distribute around, hopefully, of just some other updates on what the state's been working on just in the past year. And to the point of, you know, is state funding going to be available long term? The funding for Housing First is coming from the real estate transfer tax. So as long as people are buying and selling properties in the state and we don't change the policy, then there will be long-term funding. And just for reference, the work that we do so far, at least on housing, is very bipartisan. For instance, the roll call vote in the Senate on that bill was 26-4. So there is really a lot of commitment to not, you know, now that we have committed to this process, we really want to, I mean, I think it's fair to say everyone who's currently elected really would like to see it stay. And of course that can fluctuate, but when you have strong bipartisan agreement, things usually do stick around for a while. So I'm optimistic, whereas I'm not always optimistic with some other funding mechanisms we have in the state. So those are just a couple of thoughts I had from listening to the conversation. Thanks for letting me chime in again, and good to be here with you all this evening.
Thanks, Nicole. Nancy, you can go ahead.
Thank you. It sounds like we're getting ready, or let me know when we are ready to start pivoting to what our next steps are. It's funny, I was in front of Senator Grosky's committee this afternoon on testimony on a bill that would support more housing choices and affordable housing. So I have some thoughts on next steps, and just one thing I'd like to say as kind of setting the stage. At defining and exploring what the issue is. And next week we'll be having a workshop on economic development, of which workforce housing is a significant issue. And I think when we talk about what are the barriers to more housing, period, it's workforce and having people in the trades. So these are all conversations. I have ideas on the accessory dwelling units as a solution that I'm eager to explore and talk with other counselors, bring in people for. The one thing I'd like to just take a moment and give a shout out to city staff. If you all recall, when we approved the ordinance at the December city council meeting, where Matt had finalized the ordinance so that we were in compliance with LD 2003, if you'll recall, he made it so that accessory dwelling units that are constructed because LD 2003 broadened the allowance and made it so that you can't bar ADUs. Matt wrote right into the ordinance, they have to be used for, if they're available for rent, it has to be rented for longer than 28 days. It was a specific strategy to ensure that while there was a law that was passed to expand housing, it would be used for housing and not for the hospitality sector. So this city is already, I think that's just a really tangible step that we can all look to as one small step we can make. And then again, when we're ready for solutions, I've got a whole bunch of notes. And then just before I stop talking at this point, thank you to all the presenters. I've been taking notes, and it's been really helpful to get the data and the perspectives from people who are working with it every day here in the city. Thank you.
Well, due to time, I think we are ready for next steps. So Nancy, if you want to keep going, you feel free to.
What I've been waiting for is that we have this workshop on the unhoused. I think it's next week, so the 29th, on the economic development strategy. And then from there, putting the pieces together through the lens of municipal action with support from the state as needed on housing. This is part of my day job. I've been advocating for 2 years on housing choices, not specifically on affordable, well, some of it is affordable housing, or on homelessness, but on how to remove barriers to housing. So there's a bunch I would love to share there of changes that have happened and more where we can move forward. I'd love to see more focus. I'd love a discussion about whether it makes sense to focus on addressing barriers to accessory dwelling units. We don't have municipal barriers. If you all have seen the accessory dwelling unit that was built on Pine Street, talking to the woman who lives there, there wasn't zoning, regulatory, or ordinances that were a barrier. The barriers are cost, for all the reasons we know that housing is currently expensive, getting a contractor, and there's more that we can explore in that. The interest rates, when you have to borrow money, are another. But I know in talking with city staff, they're really interested in how can we work. So just an initial, are accessory dwelling units one tangible strategy that we can explore supporting people who want to have an accessory dwelling unit for a rental available? I think breaking it into workable pieces like that. And I can share some more resources. I know people at the state level who could come in and talk about what we're seeing. So I guess that's what I'll put out at this point to get the process going as we're looking for what we need people to do next.
And I'll piggyback off of that. So the city is currently doing a housing study in conjunction with our comprehensive plan update. And right now the consultants are just doing a baseline statistics, gathering of statistics and information. But once that baseline's done, we'll be setting up a housing task force, which will involve a lot of people in this room, but also some developers, just people who are trying to find different types of housing and can't. And so that is one method where this conversation will continue forward and potentially lay out some action plans to be included in that housing study. So I just want to throw that out there. but if there's also specifically on the social services side, more regular conversations you think we could host or the community could host, Tina, we can work on organizing those.
Yeah, general assistance is a small portion of this. I'm a little overwhelmed tonight, actually, by all the information. I mean, we are pretty much like the financial end of this overall problem, so I'm looking forward to actually working with Matt and learning a lot more about these barriers that we're coming up against for our housing situation, and I would actually like to be a little bit more involved in it too, because I'm kind of like in a little bubble currently, overwhelmed by the homelessness situation that we're trying to deal with, but I'd like to be a part of fixing the issue. I mean, really can't really say more than that, like I need to learn more.
So I think that I've taken 5 pages of notes myself
Yeah,
tonight. This has
that's
been
great.
incredible. I really have learned so much about this situation, and I think, I know you've been taking notes, and is there a way, I'd like to continue this conversation also, and not just stop here and say, well, we've heard everything and move on. But I think personally, I would like to digest this information, my notes and anything that you have, if you could put it together and send it out, and then, you know, I kind of like what you said about a housing task force to begin with, but, you know, listening to Dale, it's such a big issue, and like you said, Ellsworth can't solve this issue. So I would love to be able to digest some of this and talk some more about what is it that the city can do that can help the situation, you know, and it being from advocacy or, you know, a low barrier shelter, and, you know, and some things like that. There are so many ideas going through my head just from listening here, and I think personally I'd like to digest it and to see where we could be, and maybe, I don't know what the council feels about this too, but maybe have a workshop a little later on, again, with the resources that we have to talk about how the city could be in a position to really make a difference in this.
I would agree. I think we've seen a handful of specific barriers emerging that everyone has echoed. There's the access to existing housing, vouchers, et cetera. There's the building, creation of new housing stock. There's transportation. There's behavioral assistance and support, and a few more. And I think if we take a little bit of time and process and speak with people in the city about what are the actual municipal levers we can pull that could address some of those, and then meet again for an additional workshop to see what makes sense with the real experts on all of this as well, that would be very helpful.
Yeah, and I think just following up on this and Nancy's comment, you know, I think housing is a really big one that I think the city can take. It probably has the most, again, we need to figure this out more and process more, but I think that's where the city can lead as much as possible, through our ordinances, through, you know, various other, you know, cooperations with state and, you know, tax acquired properties potentially, or TIFs or things of that nature. And the fact that, you know, leading into the comp plan, it's a good timing with the comp plan and the housing study and the housing task force. I think that's, and as Nancy was saying, it seems like we're building towards a focus on housing, so maybe that's a real confluence right now where we can, and again, engage with our, you know, our partners and stakeholders in the community. You know, the housing issue is, you know, this is an important group here, where there's, you know, the developers, there's a lot of other people involved, that we can keep that conversation going, but it's not the only thing we can do, but it seems like that's the where we can have the most impact, the quickest, to help address this issue.
Anyone else would like to? Would anyone else like to speak before we end the workshop?
In my other hat, I work with a lot of different towns and cities, and Ellsworth's got an A+ for engagement early in this crisis, and I'm really just happy to be here, and I think I speak for everyone. It's just really refreshing to be invited to have this discussion, because we can't find solutions tonight, we know that, but it's good to be in a room with the government, the local government, to just share the stress of this enormous challenge. So thank you. That's really all it is.
And thank you to Councillor Stein, who really brought it to our attention, the discussion, and helped facilitate this, so thank you.
I'd also like to say thank you, because you're going to be missed.
I'll still be around, just in a different organization, but not in the same work, so
Casey.
we'll cross pollinate.
Oh, Casey? Casey has a hand up.
Yeah, so she can unmute.
Can you hear me?
Yep.
Yeah.
Yes.
I know this is not primarily a mental health problem, but it's certainly adjacent to mental health in a lot of ways. And I think we all know that we live kind of within a broken healthcare system, and I just want to say specifically to the Northern Light system that I think it's really important for all health systems to be part of the solution with finding enough treatment options for all different kinds of mental health, both substance abuse and other kinds of mental health. And I don't think any health organization is actually adequately tackling that, and I know it's difficult, but I just want to say how important that piece of it is, and it behooves all of us who work in healthcare to be working on that and be advocating for that, even though it is not a moneymaker. That's all.
Thank you. Okay,
All right.
thank you again,
Thanks,
everyone.
everybody.
I really appreciate you all coming.
Thanks for all the work you're all doing.
Yeah, thank you so much.
Good night, Nancy. Good night, Casey. You're still on.